Good afternoon, everybody. Welcome to the weekly Greater Manchester COVID media briefing, joined today by both Deputy Mayors, Sir Richard Leese, who will take you through the latest statistics in a moment, and also by Baroness Beverly Hughes, Deputy Mayor for Policing and Crime. But first, to the latest stats, I'll hand you over to Sir Richard Leese. Richard.
Thanks, Andy. We've got the first table up there, which shows the 7-day rate of positive cases per 100,000, which for a large number of weeks we've been describing as the best way of being able to show what's going on in Greater Manchester. First of all, you can see that the figures continue to rise in Manchester's case almost exponentially in terms of the number of cases, and as a measure of what's going on, I think it's becoming slightly weaker, and I'll explain that in a minute. The first thing to say is that we've now had restrictions in place in Greater Manchester across most of the county for 9 weeks. Oldham has had higher levels of restrictions for 6 weeks, and over most of that period of time, cases have continued to increase. So there is not really any evidence that the restrictions are working, and I know some experts would suggest that without those restrictions the figures will be even worse. Well, if you can't compare with other places, for example, if you compare Manchester with Liverpool that has not had restrictions for the same period of time, you have to wonder why Manchester's overall figure is worse than Liverpool's on that basis. So I think there is an increasing amount of evidence that the restrictions aren't working, and of course they are causing economic damage. They are putting people's long-term jobs and health at risk. In terms of understanding the figures, some of this is to do with demography and the different demography across Greater Manchester. If you take Manchester's figure there, 561.6, enormous compared with even 3 weeks ago. Of the cases over the last 7 days in Manchester, 55% of them were in the 17 to 21 age group, less than 2.5% in the over 65 age group. This is something that is hitting particularly young demographic, very large student numbers, and students are affected, and significant numbers of the students testing positive are asymptomatic. So we had a batch, I think, of 220 students at Manchester Metropolitan University. Over 90% of them that tested positive were asymptomatic. A very different issue to what we faced in April and May. And of course, a lot of this is students living within a student environment, so posing very, very little risk to community at large. Issues with students are both about their own physical health, but clearly also around mental health as well, which we are working on all of that. But at the other end of that, you've got a place like Tameside where their issues are, they have a much older demographic, and that's where the issues lie. And I think you have to ask, with those very different demographic circumstances, does applying the same blanket measures everywhere do the job? And again, so far the evidence seems to suggest it doesn't do the job, that we do need certainly a common basket of measures, but ones that can be deployed differently in different places to meet the circumstances we are in. Although that's the overall number of cases, and if we turn to next slide, I think, and if we can, which is the Pillar 2 testing per 100,000 population. But I really want to go, clearly you see a very high figure again for Manchester, which largely reflects mass testing of students at the moment. Most other places hovering around the same sort of level. Again, I think this does reflect now, which it didn't a few weeks ago, but does now reflect far higher levels of testing, and that testing is increasingly becoming more reliable at the moment, again, given the problems of the last couple of weeks. If we turn to the third and I think the final slide. Okay, this is one that we haven't shown before, but it's really, really important. And I'm just really going to talk about the top couple of lines, and where you see weekly admissions to hospitals for COVID-19. And you'll see there that over the last 7-day period, weekly admissions to hospital have actually gone down. They're now lower than they were 4 weeks ago. However, what you also see is a figure of weekly inpatient diagnoses for COVID-19, and that figure has continued to increase. Now, that's a figure that raises all sorts of questions. These are people who clearly were not admitted to hospital for COVID-19. What we don't know, and we have to do more work on, is there transmission in hospital? Is this people being tested on admission to hospital? So perhaps a lot of people who are asymptomatic, who when admitted, although they're asymptomatic with COVID-19, they're testing positive. What are they being treated for? Are they being treated for the reason that they were admitted, or how many of those are having to receive treatment for COVID-19? Clearly, we know that they have to be in isolated from non-COVID positive patients, but there's a lot of questions there about really what is going on, and we need to understand that better. Underpinning all of that, it's still the case that calls to 111 are relatively low. As we can see, admissions themselves for COVID-19 are relatively low. The number of ICU beds being occupied, again, has gone down by 1 over the last 7 days, so that does appear to be relatively stable. Probably the single most important figure underlying all of this is the death rate, and we are still seeing, said before, any deaths are clearly too high, but actually the death rate from COVID-19 is still very, very low, and certainly nothing like the levels we saw in April and May. All of this says is that whatever it is that we are dealing with now, it is both quantitatively and qualitatively different to what we were dealing with in April and May. And I think that strengthens the arguments we've been making, that there really needs to be a proper dialogue with government about exactly what is going on and what the most appropriate measures are, rather than having measures imposed on us, often at no notice whatsoever, with no regard to what local circumstances are. I think I'll conclude there. I know there are like to be questions about the, well, I can see one question already about universities, Andy, but I'll pick those up when we get to the Q&A, I think.
That's great. Thanks very much indeed, Richard. So I'll hand straight over to our other Deputy Mayor, Baroness Beverly Hughes. Bev.
Thank you, Andy. I'll be very brief on this occasion, because the picture is pretty much as I've described in previous weeks as far as policing and enforcement is concerned, apart from the change to the 10 p.m. Closing times for the hospitality sector, which I will touch on. The dedicated live operations that I've reported on before every weekend are continuing, with some recent changes in shift patterns for police officers to make sure that around the time of the 10 p.m. watershed, there is a more visible presence and capability at that time. That of itself has, the 10 p.m. closure has created other issues with large congregations in public spaces, congregations around supermarkets and off licenses and so on, difficulties for people getting home, lack of taxis and private hire, meaning that people, stand around in very large groups. The situation in Piccadilly Gardens was difficult over the last weekend, with the police taking out a special section 60 of the Public Protection Order Act over Friday, Saturday. This was because of a number of incidents involving blades in that area, together with very large numbers of people, that the police took those powers in order to be able to stop and search on a preventative basis. That was necessary. I think the operations with businesses generally are continuing, about 300 visits a week. Generally, reports of overall good compliance with what businesses need to do to keep themselves and customers safe. That's not necessarily the case, though, with hospitality businesses. There are still issues there around the situations inside premises. But certainly in terms of retail and other businesses, there is generally very good compliance. Reports from the public about large gatherings are increasing. There were 502 reports over last weekend. It's gone up every weekend for the last 6 weeks. When the police visit, most are either compliant or they're willing to accept the advice of the police. There are issues about students that I think we'll touch on later. Some very large gatherings, though, some very persistent offenders. One woman in Bolton who is now on her 4th penalty notice, having had a very large party in her house again. So the totting up of her 6 penalty notices is coming up to £1,500 at the moment. So very significant. 406 penalty notices in total have been issued by the police now, 85 over the last weekend, Friday to Sunday. So there are some persistent offenders, in that general picture of overall compliance. There are also some large gatherings, particularly around parties, funerals, some very large funerals that have needed their own police operations themselves, which is a resource issue. Also weddings increasingly features. I don't know if people have put off their weddings that were going to be in the spring and now feel, they've got to get on with it, but it almost feels as if the fines that people will get, the fixed penalty notices, are being factored in now as a cost people will bear in order to go ahead with their weddings. So that's overall the general picture, Andy. I'll leave it there.
Thanks very much indeed, Bev, and also to Richard. Just a few comments from me before we open up to your questions. Obviously, it's a challenging situation across the north of England. I'm going to return to something that I said earlier in the crisis, which was that national lockdown was lifted too early, in my view, for the north. It was a London-centric decision to lift it when it was lifted. And as a result, I think we have struggled ever since to get the case numbers down. And it now follows from that the government needs to help the north deal with the situation that we have. Now, what we're beginning to see are kind of rumours, leaks, briefings that a tier system, as colleagues will know, is about to be brought in. But today there have been reports that there might even be action ahead of that with relation to hospitality in the north of England. So all of that is sort of swirling round at the moment. And Sir Richard and I have had conversations with other northern leaders, as you can see, and I just want to give you a bit of a sense of where we are, and actually some messages to the government so that we do this in the right way and learn from some of what we've been through so far in this crisis. The first point I would put down as a clear request to the government is that they must open meaningful negotiations with mayors and leaders about these matters. We do have the odd conversation here and there with ministers, but we need proper discussion. As Sir Richard said, we will not have a tier system imposed upon us without us having the ability to see and agree the detail. I mean, that is just a prerequisite, really, because if there isn't that opportunity, then the system won't have the legitimacy and the support that the government will no doubt want for it. But we're still in the position where too much is being decided behind closed doors, without the detail being provided to council leaders and mayors, and that is not acceptable given the seriousness of the situation in which we find ourselves. The second point I would put over very strongly is that any tier system, or indeed any potential restriction, and as you'll know, there's a lot of scepticism about restrictions here and across the north in terms of what they can achieve. But any new system has to come with a substantial support package for councils, for businesses, but also for the individuals who are affected by those decisions. And let me particularly then talk about any potential tier 3 where non-essential retail and hospitality would probably be closed or could be closed. You know, we cannot have a repeat of the situation that we saw in Bolton, where people who had jobs behind bars or in kitchens were basically told from one day to the next that they had no job to go to and no local furlough scheme to fall back on. That is simply unacceptable. And I would not accept any closure of businesses without the employees of those businesses having the ability to access a furlough scheme and to support them while those businesses were closed. That takes me more broadly into the ending within weeks now of the furlough scheme overall. We have around, it's estimated, 100,000 people still on furlough in Greater Manchester. And you have to look at the combined effect here of local restrictions, the new tier system, if this is what the government are going to bring in, combined with what's already happening to our economy through the withdrawal of the support that's been in the economy for most of this year. And let me take particularly industries that can't return anytime soon, like aviation, a massive employer in Greater Manchester. If our area is under restrictions, with all of the damaging effect that has on the economy, and then we see the ending of furlough as well, what you begin to see is a cumulative effect here that could be very, very damaging indeed. And I think the government needs to review the end of furlough in the areas that are going to be under local restrictions. It's why we need a substantial support package linked to any proposed tier 2 and a substantial support package linked to any proposed tier 3. And without which, I don't think there are any leaders in certainly Greater Manchester, and I would guess around the north, who would give their support to a tier system. It has to come with substantial support, and that is a non-negotiable message that we're sending back to the government today. But finally, there has to be an exit route too, and we have to end the situation where local areas are being placed under restrictions without any ability or without sufficient ability to change what is happening within their communities, and without being subject to a test and trace system, which we still say is not working as well as it should. And that means that with the any local restriction should come greater ability to take local control of the test and trace system, and that potentially is the exit route for areas under restriction, so that they can have more ability to turn the situation around. So that is a very clear view from us. I repeat what I've said throughout this, that we are prepared to work in partnership with the government. There is a very difficult winter now ahead of us. Time is running out to get these things right. And it is now urgent that we get the support in place. Otherwise, the north-south divide will be widened. The north will be under restrictions for the winter, which will, in the end, level us down, not up. It's not acceptable anymore for the government to adopt an approach which is restrictions as the first port of call and just putting those on places without the support that is needed. So that's where we are, colleagues. I will leave it there. I will hand over to Ross, who I think is going to take us through your questions this afternoon. So over to you, Ross.
Thanks very much, Andy. Just to follow on from the point you were making there, I'm going to take two questions. The first from Eloise Linford at Hits Radio, and that's from 2 o'clock. Andy, you say you want more power locally, but what are you suggesting you do differently to what's in place that would bring cases back down here? And also, I'm going to take a similar question from Dan Hewitt from ITV News at 2:07. Andy, leaders in the north of England are asking for more powers to manage local restrictions. If you had these powers now, what specifically would you do differently? would you close pubs, bars and restaurants right now with infection rates rising?
So thank you, thanks Dan, thanks Eloise for your questions. In some ways it's not powers for me, it's powers for our councils. So let me give you two examples, one Sir Richard touched on. The first example I would give would be to come back to a point I've made many times around contact tracing. So many of our councils, in fact, I think certainly 9, possibly now even 10, are now doing more contact tracing. There has been, to be fair to the government, greater localization of contact tracing. So now we're in a position where if the national system can't reach somebody who's tested positive within a day, that information will be passed to local authorities, and then they will seek to make contact with those people, and often do so with a much higher success rate. Will always do so with a higher success rate. What is happening though, as the cases increase, the councils don't have those resources on the ground to keep pace with the increase in demand. So what has to happen, in my view, is resources freed up from the national test and trace system to go into local authorities. And the reason why they're more successful is a simple one. They deal with people on the ground in communities on doorsteps, whereas the national system is a call centre operation. And it's not surprising that there is more success when you go with an operation that's much closer to the communities affected. The second example Richard did touch on, and it's a call we've made again repeatedly, and that is for stronger powers for local authorities to close business premises, and particularly licensed premises, where sufficient regard is not being paid to the implementation of the rules and all of the procedures and protocols needed. Summary closure powers, that's what's been called for, and that is an example of the targeted measures that we want, as opposed to some of the blanket measures that can go right across businesses. The majority who are doing the right thing hit by the same thing, when actually we need to target our efforts sometimes on the minority. And this is something that we think could be done. It could be done quickly, and is an example of how we would want to adopt a different approach to the one that's being imposed top down.
Thanks, Andy. Richard, would you like to come in on that one?
I'm only going to add one thing to the examples Andy's given, but the one thing I'll give is really around off sales. And around about 3 weeks ago, when Andy wrote on behalf of the leaders to the Secretary of State, we talked about, when we're talking about potential curfews, which we've got now, I think we made it clear that off sales had to close before on sale premises, otherwise we would end up with what we've got now. So actually, if we are going to have any form of curfew on licensed premises, we would want the power to require off sales to cease before premises have closed, so we don't get what we have had all over Greater Manchester, particularly the city centre, enormous queues at 10 o'clock outside supermarkets and other off licences to stock up, often then filling our streets and causing all sorts of problems.
Thanks, Richard. You referenced the universities in your opening remarks. There's a question from Niall Griffiths here. What do you think is the solution to curbing further COVID-19 outbreaks at university? And in light of the news that both Manchester universities are moving to teaching online until the end of October, is it fair that students will have to pay the full £9,000 a year in tuition when many of them have been stuck inside for the foreseeable future?
Well, I think the starting point is understanding what the problem is, and we have, I think, two problems, Niall. One is one that is reducing, but we suddenly saw a rapid increase in house parties in areas like Fallowfield, Withington, as students returned, as well as taking the normal action in order to stop those house parties, where a fair number of fixed penalty notices have been issued. that in many cases that students are then being given warnings by the universities and have started to move in a very small number of cases, I'm pleased to say, because we don't want students losing their education, but have been moving towards disciplinary action. So we are, again, working very, very closely with the universities to address that problem. The other particular problem is in halls of residence, and again, there are daily meetings between public health in Manchester with Manchester Metropolitan University, University of Manchester, Royal Northern College of Music. So there's been cooperative work with Salford University as well, because clearly some of their students will be living within Manchester, and that is really to make sure that there is effective management of student halls of residence, not only working with where the universities are direct providers, but also with private sector organisations like Unite, who also run accommodation, quite a lot of accommodation, to make sure that they are managing the premises in an effective way. The universities themselves are doing an awful lot to make sure that they do support students, that they recognise that this can put a lot of stress on particular individuals that what for some of them will already be a stressful time coming to university in the first place. So the universities are working really, really hard on making sure that students do get that support. As far as the teaching is concerned, I think the press release said that most teaching will move to be online until the end of October. There is actually a fair chunk of teaching that hasn't moved online because you can't move it online. So, for example, students that require access to labs as part of their course still have access to labs. That work is going on. There are people with particular professional qualifications that have to be on the premises. That is going on. RNCNs, music tuition, students are still being able to use rehearsal rooms there. So where there absolutely needs to be a presence on site, that is still happening. And I suppose that in part answers the second part of the question, is that the measures that the universities have been taking has ensured that students are still getting all the tuition that they need, that they should expect, including, if necessary, where they have to be on site. So I think that probably answers both of those parts of that question.
Thanks. Andy, did you want to add anything to that?
Only briefly to say, Niall, that I think this is one for the government, isn't it, rather than necessarily the universities concerned, because universities are still going to be facing a big financial challenge themselves. The question has got to be, is it fair that this generation has suffered massive disruption, if they're going to have prolonged teaching online, is it fair that they're left paying the full £9,000 when they haven't had the full university experience? And I would say not if this goes on and on. If it's a 2-week self-isolation, well, that could happen to anybody, you know, and that's something that we're all having to live with at the moment. But if there is prolonged disruption to the quality of what's provided and the university experience, then you would hope the government would recognise that and would recompense a generation that's already suffered quite massive disruption to their lives.
Thanks, Andy. A question from Joshy Herman at the Mill for Bev. According to the GMCA website, the GM test and trace system involves sharing personal information with GMP. Are you concerned about that in light of the news of the last week about a very serious data breach at GMP, in which the force allowed the highly sensitive personal information of rape victims and other victims of crime to be accessed online? GMP originally didn't inform you of that breach, but have they now supplied you with an explanation that means you can tell the public that the information they give confidence to test and trace is safe in GMP's hands?
Thanks, Joshy. On test and trace, yes, I can confirm that those arrangements in which a number of different kinds of people, firefighters, police community support officers, are assisting with the contacting of those people who can't be reached by phone, by going and knocking on doors and talking to people. They're covered by very robust data sharing arrangements that between national and local areas and between the various agencies concerned. So I don't have any concerns about that, and I'm glad that we have got the capacity here in Greater Manchester through the police and the fire service to support that activity. On the data breach which you reported, I'd just like to correct a couple of things in your report, if I may, which I have to say in every other respect was, completely accurate. But firstly, there was no breach of the IOP system. The IOP system was not accessible online. What happened was that a special data set created for the testing of a new product, a new dashboard, that was loaded up with some real data inappropriately, without permission, by the contractor responsible, and that was put online. So it's a very serious breach. I'm taking it very, very seriously. It's not only a breach on the data requirements, it's actually a breach of that company's contract with GMP, and we'll be taking up those responsible officer. The investigation in JNP continues. The Information Commissioner is also investigating, and I have written formally to the Chief Constable with a series of questions that the Mayor and I want answered. But I just thought it was worth saying that there was no breach of the IOP system itself.
Thanks, Bev. Going to go to a question from Tom Parmenter at Sky News at 2:02 for Andy in the first instance. Why haven't local restrictions worked? How urgent is the need for local control of them? And what is at stake for northern cities if this isn't addressed? And a similar question from Emily Ashton at Bloomberg at 2:04. Why do you think the infection rates have continued to rise here despite local lockdown measures? What exactly has gone wrong? Do you think a national approach would work better?
Thank you both. Thanks, Emily. Thanks, Tom. I think you could make a good case that the restrictions, when they were first introduced, slowed the rate of increases that we were seeing. But I am also of the view that their effectiveness has become more limited the longer that they've been in. And the reason why that has happened is because of the complexity, number one. They are too complex. Sir Richard and I think, pointed out almost on day one that the inclusion of gardens in the restriction was unnecessary, but it was. And then, of course, when national messaging changed around the rule of 6, I don't think the government ever properly explained how that fitted with what we already had in place, because of course the rule of 6 doesn't apply in the same way here, because people are asked not to mix at home or in a public venue. So what you've had is these restrictions in place with a lot of complexity and conflicting messages between the national level and the local level. And as Bev has said, and I know Richard feels the same way, also in some ways contradict things that are contradicting the effect of the restrictions. So the 10 p.m. curfew, in my view, is an example of that. The restrictions are seeking to minimise gatherings in the home. The 10 p.m. curfew creates more gatherings in the home, in my view. So this is where things have got confused, and this is why we need a reset. Now, whether that's in the tiers or not, that's to be debated. But there is a case for the tiers if they are to bring more clarity and more simplicity to the situation. What we would say here is that the government shouldn't go to more restrictive measures until there is a cast iron case to do so. Because what we do see is that those measures cause real harm to the economy. They affect people's lives, but we haven't yet seen the evidence base to support that level of intervention. And we continue to argue for more effective targeted interventions around a localized test and trace operation of the kind that I spoke about before. Getting self-isolation right, it still isn't right. This £500 payment that the government's introduced, I understand, is taxed. It's paid in instalments. There's all kinds of complexities with it. And actually, it still isn't in we were told yesterday that it's only going to come in on the 12th of October. So that's a frustration as well. You know, that is something we've long called for that still isn't in place. I've mentioned those summary closure powers, which we believe would help. We would like to take stronger enforcement action against supermarkets that, in my view, are not doing enough to ensure that customers are wearing face coverings. There's a whole range of things that we would like to do, and actually should be done first before restrictions are imposed. It's felt through the summer that the government's first port of call is to impose restrictions rather than localise, test and trace and do some of the other things that we've mentioned. So I'm not going to argue that restrictions have no effect, but I think it's a limited effect on their own, and I think the government has placed disproportionate sort of reliance on restrictions to turn things around. And the last point to make is, if you have restrictions without support, they are doomed to fail, because you won't get the buy-in of people to adhere to those restrictions if they haven't got the financial ability, wherewithal to do that. So, you know, it's got to be the case that restrictions come with proper support. I think it was frankly disgraceful that people in Bolton saw their place of work closed without any ability to access funding support as a result of that. So these are the things that haven't been got right to this point, and they have to be got right before the winter. Otherwise, we are going into a very dangerous winter for Greater Manchester and for the north of England. And it's why I say the government has to open meaningful negotiations with us to get all of this in a much better place than it is right now. For any of this to be imposed in the way that we've seen throughout this, I think means that we are going to be in a really difficult place. So, you know, local restrictions might be part of the answer, but they're only at best part of the answer. Much more needs to come besides.
Thanks, Andy. Richard, do you want to come in?
Yeah, I do, please, to add a couple of things, particularly to Emily's question around this, which is why do you think the infection rates have continued to rise? Well, I think it's something that actually needs some proper research into that, and to be done very, very quickly. So anything we say has to be an element of conjecture, and I don't think that work's being done nationally either. And that's part of the issue we face, is that we are having measures imposed nationally. The problem is we've got a national approach, so a national approach wouldn't work better because it's not working at the moment. But it seems to be a national approach which is imposing restrictions that do not seem to have an evidence base to support them. And I think what we do know is that some of those restrictions are, in practicality, are completely unenforceable. So the ability to restrict visitors in people's homes unless they start causing a nuisance to neighbours is almost impossible to police. In fact, it is impossible to police unless we got into a sort of East German Stasi type situation, which I think Priti Patel has suggested once, that everybody ought to be informers on their neighbours. It's not going to happen. So we've got unenforceable measures, but we also clearly, amongst our younger population, our under 40-year-olds, that's not necessarily precisely the exact age, but they've worked out that even if they test positive, the impact on them is virtually nil. Once you've got people recognising that, getting them to then change the way they live their lives becomes a lot more difficult. But say, we are in the area of conjecture rather than proper research evidence about why people are behaving in the way that they are behaving. I think the last thing to add, and it's repeating something I did say in the introduction, from what we can see of the data, it would seem to suggest that people who are more vulnerable, whether it's through age or through underlying conditions, are sensibly making sure that they protect them and themselves. And that's, I think, why we've not seen in the same extent the sort of cases we had back in April and May.
Thanks, Richard. A bit of a follow-on question from Andy Bounds at the FT, 207. The virus is rising exponentially. Surely even a world-beating testing system would not be enough to contain it. A full lockdown is the only thing that has reduced them anywhere. What further restrictions are needed, and how much money is needed to back them up from government before those student cases spill into the wider community?
Is that for Richard Ross? Or?
Yeah, I was going to put that to Richard in the first instance, sorry.
Yeah, I'll kick off on that. Total lockdown is the only solution. Well, actually, total lockdown, I know Andy said that we probably came out of lockdown too early. Total lockdown hasn't worked here, and as far as I can see, it hasn't worked anywhere else either. So whilst it certainly significantly reduced the level of infection, it didn't eliminate the rate of infection. And even places, and I'll cite New Zealand, that thought they had completely eliminated the virus, it's come back. Because whilst the virus is still around, it can be transmitted. So a world-beating testing system would help enormously, because for the vast majority of the population who don't want to actively infect other people, it will give them the information that allows them to make sure that they don't do that. If we're really going to get to the point of even not necessarily to complete eradication, but large-scale eradication, it requires therapies at work, and we're certainly getting some that are making a difference there. Clearly, the treatments available in hospitals are far better than they were a few months ago, and we need effective vaccines as well. So I think going into another total lockdown which will kill people through deprivation, through poverty, will create enormous mental health problems. Well, if it solves one problem at all, will only do so by creating other problems and other problems that are potentially far more damaging.
Thanks, Richard. Andy, do you want to come in on that one?
Just to add very briefly, I mean, the question, Andy, has got to be to look at the hospital figures, isn't it? That's the key thing, I think, to watch at the moment. The aim is obviously, even though cases might be rising, the aim is not to see that wider transmission from within, let's say, the student population into the wider community. And I think you have to move very carefully into this territory. I would say test and trace is true. I think would work better on a lower number of cases, and there comes a point when there are too many cases and the system struggles to work. But what I would say is that the government needs to ensure that whatever it does is proportionate, that it carries the public with it. I think we've seen too many knee-jerk policy solutions put forward recently. The 10 p.m. curfew is a prime example of this, and the evidence hasn't been there to support it. If there is to be any further circuit break, as people describe it, then I would say it would only be justified if it was time limited, if it was evidence based, and if it then allowed us to reset the whole test and trace operation. And I think it needs to come as part of a kind of a wider strategy, if it's to be considered at all. But I think if it is to be considered, it's got to be linked to what is actually happening in the NHS, rather than just the headline rate with regard to numbers of cases.
Thanks, Andy. I'm conscious of time, given so many questions, so I may not be able to get to everybody's second questions, but I will make sure everybody gets one. Andy, question from Christian Brooks at the BBC. Do you support a campaign for a monument of Len Johnson in the city, and how big a step could it be in celebrating the city's diverse history?
I think, Ross, that might actually be one for Richard. Actually, he decides, and Manchester City Council decide about monuments in the city. And I think Len was a resident of Collyhurst, was it? Certainly the northern part of the city. But I think in terms of what he did, particularly as we mark Black History Month this year, I think his story absolutely needs to be told and celebrated, because he wasn't just I think a world heavyweight, a world champion. I'm not sure heavyweight, but he was certainly a champion boxer. It was more what he did to contribute to the civil rights movement, working with the likes of Paul Robeson and others, which I think was his biggest contribution. And yeah, I think a story that maybe hasn't been told enough. As to a monument, I think I better leave that to those who are the decision makers on such things.
That's great. Richard, did you want to come in on that one?
Well, yes, actually, I don't think he was world champion, because one of the things he suffered, there was the discrimination that because he was black, he was not allowed to take part in championship bouts, and I think that is something important about him. I think it'd be great to have a statue of Len Johnson in Manchester, and if people want to come forward with proposals in the way that other statues have been done recently, I think that would be brilliant. And we do, I think, we've only got a couple of busts or statues of black Mancunians. The very first one actually was done in the late 80s, when there is a bust was made of Yomi Mambu, who was the first black Lord Mayor of Manchester in 1987. That's sadly in storage at the moment because it was a bust in the town hall, but we look forward to having that back on display. But my colleague Lutfer Rahman, who's our executive member for statues, that's not his title by the way, but statue is doing that review to look at what we've got and what we ought to do about what we've got and what we haven't got, so that we do have public representations that really do represent the whole history of the city, and clearly doing that is really, really important.
Thanks,
Richard. I think Len was from Clayton, Ross. I probably should just correct myself there, not Collinghurst.
Thanks very much, Andy. Moving on to two questions about the GMSF for you, Andy. Charlotte Green at 206 asks, how do you feel about Tameside objecting to the Greater Manchester Spatial Framework at the last moment, threatening to derail it and causing it to be delayed yet again after 5 years of work? And there's a GMSF question as part of Kevin Fitzpatrick's at 226 as well. It was due this week. When will it now be published after the Bredbury site compromise was agreed?
Okay, thanks, Charlotte. I don't think you could describe this as just a last-minute objection. So there had been concerns expressed about the site, and I think there were ongoing discussions between both councils. But then there was a planning application which further complicated the situation. So that is the situation that we were in. What I can say to you today is that the two leaders and the two councils concerned have come to an agreement in principle, which is really welcome, and I'd like to thank both Tameside and Stockport for the way in which they've approached this. Technical work is being done now on that proposed solution, so it's not through any political disagreement. This is simply about work being done to put all of the technical appraisals in place. So we're hoping that it can move forward soon. I mean, there's no impediment from our point of view other than the completion of the necessary work. And I should just say, I mean, it's really important for me to start to kind of get over to people why the GMSF is such an important thing. If we don't have a plan in place, the green belt will be more exposed to speculative development. Who would thank me coming out of a crisis like this for having no economic plan for Greater Manchester? That's another reason why it needs to move forward. It helps us bring in resources from the government on brownfield, for instance, and we recently got £80 million there because we have a clear plan. And for some of the boroughs concerned, Tameside, Stockport and others, it enables them to build below their housing need. And if we didn't have a plan, they'd have to build more. And those opposing the GMSF in those boroughs need to think long and hard about that. So actually, to be honest, we've been through a long journey, as you say, 5 years of work. And at each stage, this GMSF has got better, it's got stronger. And the draft that will eventually be put before the public for further consultation will be even stronger still. And people will be able to see how some of the views that were put in as part of the last consultation have actually been taken on board. So, you know, we're really listening to people. We're really working hard to get this plan right. But Greater Manchester needs a plan for where we're going. We need a plan to protect our green belt. And actually, for boroughs like Stockport, this plan delivers so much in terms of the Mayoral Development Corporation, infrastructure to support that, Metrolink to Stockport, all of those things. This needs to be seen in the round. And, you know, I'm certainly, once we've got this technical work done and we can move forward, there needs to be a more positive case made for the Greater Manchester Spatial Framework. And it falls to me to make that case, and I will. And I will be going out and asking for people's support, because if we look at the bigger picture for Greater Manchester, I think we really now need to know where we're going from a planning and economic development point of view, and the GMSF will give us that framework, as difficult as it's been. But actually there will be a further round of consultation, so still an opportunity for people to put in their views to make it even stronger still. So that's where we are as of today. Did I cover Kevin's point, Ross? Just want to check that I have.
I think so, yep.
Yep.
And just Kevin also asks, on the Clean Air Plan consultation that begins tomorrow, how can you propose a plan based partly on a hope that the government will give you 150 million to help companies upgrade vehicles? Without that cash, is the plan unviable?
Well, so how can we propose a plan? It's actually the districts that are under a legal instruction, Kevin. So it's not about a kind of voluntary choice necessarily, just though we've just decided one day to do this. There is a legal requirement on our 10 districts to develop a credible plan to clean up air pollution. So, you know, and that is effectively a government mandate, and we have no real choice about that. What I'm working hard to do is ensure that there is a proper support package in place, particularly for our taxi drivers and taxi companies, who I know have had a really tough year. But if we can help them to change to a more modern, cleaner vehicle, we think that will be setting them up for the future. So we're working hard to give them a really beneficial financial package. We know, though, it will impact on others, such as those operating vans around Greater Manchester, buses and HGVs. What I would say in response to your question is that we do need government support to do this. You know, we can't undertake something as big as this without having that help. And actually, if the government doesn't help us, it will be at risk of this whole thing being linked to a government clean air tax. It's not a congestion charge because it's a very different proposal. But actually, if the government doesn't put in enough support, then, you know, the risk will be that it rebounds on them, and it's something that I don't want for them. We don't want. We all want to get this right, and I just hope that the government will come to the table with the resources that we need to clean up our air and actually kickstart the reform of public transport too, because alongside the Clean Air Plan, we want to introduce minimum licensing standards for taxis so that we raise the quality of our taxi fleet, single livery for our taxis, as people would expect to see in a world-class city anywhere around the world. Of course, it will allow us to invest in more electric buses. This could be quite an exciting process of change for transport in Greater Manchester, and we very much want to work with the government on it to make it as successful as possible.
Thanks, Andy. We've still got about 12 questions, so if you're okay, we'll just run on a little bit after 3 p.m. Kevin Gopal at Big Issue North asks Andy, could you comment on migrant charities' concerns that failed asylum seekers in Greater Manchester are now receiving letters from Serco evicting them from emergency accommodation, even though they're in areas subject to extra lockdown measures?
Well, Sir Richard and I have both raised concerns about the operations of Serco in Greater Manchester with regard to asylum dispersal. But actually, I wasn't aware, Kevin, of the precise issue that you raised, which sounds pretty appalling to me if people are being given eviction notices. That cannot possibly be right. So if you wouldn't mind, if you would give me the details of that, I will raise that urgently with the Home Office.
Thanks. Michael Gaffney, Heart and Smooth. The latest figures suggest about 1 in 180 people in the city of Manchester have been infected with COVID over the last 7 days, covered by the data. How many of them are we expecting to need hospital treatment over the coming weeks, and what's the plan for dealing with that? So Richard, do you want to take that one first?
Well, I think this follows on from what I said earlier. It's an enormous number of those people are asymptomatic. I talked about the 200 odd students who tested positive, but over 90% were asymptomatic. So whilst we expect with the sheer number of cases, there is probably going to be some increase in hospital admissions. That's a slight increase at the moment, but clearly it is a concern as we go into the winter that might accelerate. So yeah, it's an issue, it's a concern, but by and large we are seeing largely younger people becoming infected, having low or no symptoms and not using medical services at all. We're having a slow increase, but it's does not seem to be getting into, say, care homes. It doesn't seem to be getting into more vulnerable parts of the population, and we need to make sure we keep it that way. Clearly, and I've seen another question on the chat, is that even if patients aren't admitted into hospital for COVID-19 but subsequently test positive, it still means that it potentially reduces capacity for other issues because they have to be kept separate from non-COVID patients. I think that's probably all I'll say.
Thanks, Richard. I know you're going to have to go shortly, so I'm just going to take 2 questions directed at you, some of which you have covered. Charlotte Wace at the Times asked, would the infection rate still be significantly high without the spike in cases amongst the student population? Outside the student population, what other factors are driving up rates? And Jennifer Williams at the MEN asks at 2:38, how worried are each of you about how Greater Manchester's hospital system gets through this winter? We clearly have a huge backlog of electives at the same time as constrained capacity and rising COVID admissions. Are you confident it's going to be able to cope?
Okay, I think on the first question, we have done the sums for the week ending October the 2nd to take students out of the 17 to 21 age group out of the figures, and by taking those out, the rate, which was then around about 500, came down to about 140 per 100,000. So clearly lower than any of the figures in that table there. So taking students out makes a phenomenal difference to the what appears to be the infection rate per 100,000 population in Manchester. In terms of the second question, that planning for the winter has been one of the most important tasks our health and care system have been doing over the past few months, really working with National Health in England, submitting their plans for how they are going to manage. The real risk, of course, is not just that COVID-19 does put more people into hospital, but we get other things, particularly the potential for a flu epidemic. But I think I'm fairly confident that our hospital network has done that planning. And just as happened in April and May, when in many respects what we were facing was far more severe, that I think they do have the capacity to manage the situation to make sure that they don't fall over. I think we'll all be grateful when we get to the other side of winter, though.
Thanks, Richard. Andy, did you want to come in on that?
Briefly, Ross, just to add that I have a high degree of confidence, Jen, to answer your question, because of the way the Greater Manchester system works. Hospitals back each other up, and also hospitals have supported social care at different points this year. So increasingly we do operate as one system, and because of that I think it puts us in a strong position to cope. And of course there is the, if you like, the insurance policy or the backup plan of the Nightingale, which can be stood up within a reasonably short space of time, although the staffing of that does need to be worked out across across the system and with the other pressures on our hospitals. So, you know, while we are planning for all scenarios, and it's obviously going to be challenging, I do have a high degree of confidence as to how our hospital system will get through this.
Thanks very much. A question from Josh Halliday at The Guardian, which I'll put to Richard first because I know he's got to go. We've carried out an analysis that shows that the most deprived parts of England are bearing the brunt of the second wave. In Manchester, 60% of areas with the city's highest infection rates were amongst the most deprived in the country. Are you concerned about the health and economic impact on the most vulnerable, given winter is on the horizon and furlough will shortly come to an end? That's one for Sir Richard first.
Absolutely concerned, and one of the things that COVID-19 has done is to really expose the inequalities that exist within our society, and particularly the inequalities in health that exist within our society. That going forward, one of our priorities for Greater Manchester is to really address inequality, in the health inequalities and the disproportionate impact that COVID-19 has had on both our poorest communities and, partly as a consequence of that, many of our Black, Asian and minority ethnic communities as well. I don't think there are necessarily quick solutions to that, but having exposed that inequalities, we really want government to work with us to take far more serious measures in order to be able to address them. We had the Marmot Review 10 years ago. We're still working with Michael Marmot now, but in his 10-year update, it showed that of all the things that he talked about 10 years ago, very little have been done by government to address them. We can't do that over the next 10-year period of time. We understand what the issues are, what the problems are. We really need to make sure now we get down and do something about it. And I'm going to have to go on that, Ross. Sorry.
Thanks very much, Richard. Andy, do you want to come in on this one?
No, I think Richard's covered most of it, but it is obviously an extremely serious situation. So what I just want to point to again is the combined effect of restrictions that we've had for 9 weeks, coming on 10 weeks now. And in the case of Oldham and Bolton, even tougher restrictions. And then if you add on to that, the effect of any potential move to a tier system, and then on top of that, the end of furlough, it's clear that the northern economy and the Greater Manchester economy is suffering more effects of restrictions here than other parts of the country. And I think it is now incumbent on the government that says it wants to close the north-south divide, says it wants to level up the country. If it leaves us in this position all winter without the support in place, we will see health inequalities widen, we will see economic inequalities widen, levelling up will become mission impossible. So, you know, that is a pretty stark message that we've delivered to the government. You know, they've been talking restrictions without support, and that, I'm afraid, is a non-starter. We need to see a substantial support package put on the table, even for the position we're in now, because if we carry on like this for a long period of time, the damage will just multiply, the jobs will be lost. And I think with the end of furlough, we are beginning to look now very much at a wave of redundancies across Greater Manchester and the rest of the north to add to the general despondency that we're facing.
Thanks, Andy. James Much at the Bolton News at 2:27 asks, will a grant be made available for Greater Manchester hospitality businesses like the one introduced in Liverpool? And Hannah Miller asks, would you support the closure of businesses in Greater Manchester if it comes with a financial package?
So James, on your question, we're trying to support our businesses in any way we can through the growth company. Of course, the regulations in Liverpool are different to the ones that we have here, in that they place legal requirements on households not to mix in hospitality venues, whereas here at the present that's only advisory. Now, I appreciate it's not a huge difference, but it is a difference. So obviously we'll keep the situation under review, and we would do whatever we can to support our businesses. But I think first and foremost the call goes out to the government to do that. And Hannah, on your question, well, I suppose the answer is it depends, doesn't it? In what circumstances are the government proposing the closure of businesses? We saw the closure of hospitality in Bolton, and again, people might debate what effect did it actually have on the figures. So these measures taken in isolation, we're doubtful of how much impact they have, and we don't think they have as much impact as the government often claims that they have. If there is to be a tier 3 that requires closure of non-essential retail and hospitality, it has to come not just with a financial package, but the full package that we saw earlier this year, where there is access to furlough, business interruption support, all of it, because otherwise, we will see a huge number of business failures and job losses right across Greater Manchester and across the north. So I think the government would be better placed, rather than just to constantly debate restrictions, to properly get in the business of fixing test and trace, giving us the targeted powers that I've spoken about today. These things are potentially going to have more impact than the blanket measures that they keep resorting to.
Thanks, Andy. A question for Bev. GMP have said that they've had a busy weekend of being called to COVID-19 breaches. Are the police finding that more people are becoming frustrated with the restrictions, and how hard it is to keep officers on top of how hard it is for officers to keep on top of enforcement?
Thanks, James. I think has been become clear through the conversations we've had on this call today, and comments by Andy and Richard also, that that there isn't a particular homogenous kind of group in the population. There's different groups of people. I think it's clear that from the number of calls that the police get, which are rising, so those are reports of what people feel are breaches, there's a great deal of concern amongst a large section of the population about breaches and about the risk that exposes everybody to in terms of infection. And as Richard said earlier, I think that reflects the fact that a lot of people who know they're at risk because of their age or their vulnerability are actually trying to keep out of situations in which they might become infected. There are certainly other groups of people, potentially younger people, who are frustrated, and I think they're frustrated because of the contradictions within the restrictions, because of the fact that they've been ever changing, they're not consistent, and as a result of those two factors, they don't really understand them, and they don't therefore kind of own the restrictions and don't feel they need to comply. In terms of the police's ability to keep on top of that, it's always a case of having to balance resources. There's no question that the demands of enforcement are, creating significant stretch for the police service, because as well as doing that, the normal business that the police deal with, missing children, domestic violence, serious crime, all of that has returned to pre-COVID levels. So it's a constant balance between responding to those calls from the public for help and responding to crime, as well as doing the enforcement. Thankfully, for the moment, the number of officers and staff has not been significantly affected in terms of their need to self-isolate. There have been some pockets of teams affected, but it hasn't affected the ability of the police to respond overall. Although if infections, carry on increasing like that, then actually that will impact not just on the police, but on all our public services, as increasingly people who work in those services need to isolate. So it's something we're constantly watching and trying to strike the right balance.
Thanks, Bev. I think we've got time for just one more question. So apologies to those people whose follow-up we didn't get to. Pat Hurst at PA asks Andy, could you comment on what he understands to be the imminent announcement of the loss of jobs at Manchester Airport?
Well, I would have to say you would have to speak to the airport about that part, but let me talk more broadly about the issues facing the airport and aviation more generally. So the government keep talking about the viability of jobs and some jobs not being viable anymore. And it's implying, I think, that of the 100,000 people on furlough in Greater Manchester still, that many of their jobs simply aren't viable. You know, there'll be no job to go back to. That clearly can't be the case with respect to Manchester Airport, some of whose employees are on furlough, as I understand it, and also the other companies linked to the airport. You know, the minute we have a vaccine, is the kind of moment that aviation can start to come back to life, and I see no reason why it wouldn't make a really strong recovery. And actually, if you don't have those people in place ready to come back straight away, I think you will then lengthen the time it takes for the airport and everything it brings to recover. You know, and this is really wrong. You know, all summer, and I've been working with the airport on this, we've been making the case to the government that they have to support aviation, because airports are at the heart of the regional economy, bringing the tourists in, bringing the business investors in. They are absolutely critical to everything that we hope to achieve. And just to leave them sort of swinging in the wind really all summer without any proper offers of support, I think is starting to then ask questions about what is their commitment as a government to the regional economy. Because if they don't back airports through this time, they are basically making the economic recovery in the regions last longer, take longer, I should say, than it would otherwise have done. So, you know, I have great sympathy for Manchester Airport and the position it has found itself in this year. And the cliff edge is clearly arriving, isn't it? Now with the failure to put in place sector-specific furlough for industries that can't return anytime soon. And by the way, you know, I would include in that live music, live theatre, live events, conferences, you know, all of the things that the Greater Manchester economy does well and really relies upon. They have been, as I say, left high and dry by the Chancellor. And it actually defeats the logic of what he did earlier in the year. You know, if you back these industries then, because you recognise they can't go back to work because of the situation we're in, that investment becomes wasted if you simply cut it off, still at a point when they can't return. It doesn't make any sense at all to me. So we need a sector-specific furlough for airports and aviation, but also for live events, live music, live theatre, and all of those other industries as well. And the government has to review this alongside the economic support that it's going to be providing to the north of England through what will be a very, very challenging winter indeed. If we don't get that support, as I said at the weekend, we are looking at a winter of dangerous discontent in the north of England, where we will be leveled down to a really worrying degree, and our economy will take much longer to recover as a result. And the government may as well forget levelling up in this parliament, because the damage that will have been done will be so great that it'll be really difficult to repair anytime soon. And it's that serious. It really is that serious. As we sort of discussed all these things here today, we don't have the right measures in place to control the virus or to support people through it. And time is running out. If things carry on like this, the north of England is going into a winter that will do serious harm to people here, to our communities, and a massive harm to our economy. And you know, we are now at the point where we're going to have to sort of drop the sort of the niceties. The government has to sit down with us and negotiate a proper package that is going to support our communities through this. We've got days, at best a week or two, to do this. And if we're to have things imposed upon us without our agreement, then I'm afraid that, you know, we're heading into a very, very bad place indeed.
Thanks, Andy. We're 15 minutes over, so unless you've got any final comments, I think we'll leave it there.
No, I think we're good, Ross. Just again to thank everybody for joining us today. We've obviously got a few very significant days ahead of us, so we will keep you all updated. But thanks again for all of your coverage, and thanks for joining again today.
Thanks, Ross. Thank you.
Thank you.